Hi there, Jim Duthie is my name and I'm a urological surgeon with a special interest in prostate cancer. I'm also the social media consultant for the New Zealand Prostate Cancer Foundation, and today we're going to talk a little bit about prostate cancer screening. Screening is testing people for a disease when they don't have any symptoms of that disease. For prostate cancer, it means a PSA blood test and a finger in the tail end, and it's pretty quick and easy. The idea behind screening is to pick up people who've got the disease at an early stage where it can be treated before it's advanced. Now this is completely different to getting testing when you've got symptoms. So if you've got trouble with your waterworks or blood in your urine, you need your prostate checked. That's not controversial. Well, the answer to this question is definitely maybe. And the reason I can't be more straightforward than that is that, to a degree, all screening tests are controversial. And this is because none of the tests that we have are both 100% sensitive and specific. Now those are technical terms, and what they mean is this. If you've got a test that's 100% sensitive, it will never miss a single case of cancer. If it's 100% specific, it means that it will never give a positive result for cancer in somebody who doesn't have cancer. Now on top of that, particularly for breast and prostate cancer, there's the issue that not all of these cancers will actually progress to the point where they'd give symptoms or limit your lifespan. There are plenty of slow-growing cancers amongst breast and prostate cancers that would never cause you problems, and you never would have known about them without the screening tests. On top of that, some of the treatments for breast and prostate cancer have some significant side effects. So in terms of testing, what we need is something that's sensitive enough that it won't miss any cancers, and specific enough that it won't cause undue stress and unnecessary testing and treatments. And at the moment we don't have that for any screening tests. Well, the simple answer to this is that not everybody will benefit from prostate cancer screening. Prostate cancer is usually a slow-growing disease, so that if you're over the age of 68, you're unlikely to live any longer if you have aggressive treatment for prostate cancers that were found through screening. Now, part of the controversy around prostate cancer screening comes from statistics like the fact that 1/3 of men over the age of 75 in the United States had prostate cancer screening last year. Now that's really a symptom of a private system where there are strong financial incentives for people to test and treat prostate cancer, and it's not the case here in New Zealand. On top of this, there used to be a lot of over-treatment of prostate cancer. Now we have a really good understanding of which are the high-risk cancers that need treatment and which are the low-risk ones that we can in many cases simply monitor. Well, first up, men who are going to live for at least 10 years. Now I mentioned that cut-off age of 68 earlier, but it's not quite that simple. If you're 63 and you've got a big beer belly, you're an enthusiastic smoker and you're allergic to exercise, it may well be that prostate cancer is not your biggest health issue. It could well be that a heart attack would finish you off before prostate cancer became a problem. And on the other hand, if you're a 70-year-old triathlete, it's entirely possible that you've got enough mileage left on your clock that aggressive treatment of prostate cancer would be in your best interests. You may have the body of a 60-year-old. On top of this, if you've got a family history of prostate cancer, and especially if there's 2 or more men in your immediate family who have had prostate cancer, you're at higher risk of prostate cancer and should seriously consider screening. Different groups have different recommendations, and some would say that if you've decided to enter into prostate cancer screening, you should start at the age of 50. We also have some evidence that we can predict which men are more likely to go into aggressive prostate cancers with a single screening test at the age of 40. Now you might have gotten the message that prostate cancer screening is a bit of a complex issue. You need to look into this for yourself, discuss it with those closest to you and get expert advice. But if you're between the ages of 40 and 68 and you're healthy, you really should seriously consider this. Now, prostate cancer screening is complex enough that if anyone says to you that screening is a waste of time or that all men should be tested, they don't understand all the issues, and you should get advice from someone else.